Hello, everybody. My name is Sean Valenta, and welcome to the webinar on Tsim, the telehealth framework that is a framework for clinical transformation via telehealth. So I'm joined with some of my good friends today, Dr. Dee Ford, who is a member of the HIMSS Future 50 class of 2021, one of only 3 clinical leaders representing the USA. Also, Emily War, who is the administrative leader for one of only 2 national telehealth centers of excellence in the country, which is a designation by the US federal government agency, HRSA. And finally, Najib Ben Brahim, who's the founder and CEO of Ignis Health, which is a software company that really pioneered looking at telehealth data analytics. So the purpose of today's webinar is to provide you with more information about Tsim, the telehealth framework that is supporting telehealth leaders and their teams on how to take a telehealth idea through development, implementation, and long-term sustainability. Tsim provides telehealth teams both clinical, technical, maybe on the business side, with a systematic approach and common language on how to proactively recognize their team's strengths, weaknesses, and gaps in telehealth service development, implementation, and management. Now, before we get started, I want to just say if you have any questions for us during the webinar, please go into the Q&A section and leave those, or any comments, things you may want to hear on future Tsim webinars. I please invite you to enter those into the Q&A section. Now, before we get started on the specifics of Tsim, I think it's important to highlight the why. So why is a standardized approach so valuable for teams? And what are some of the challenges that telehealth organizations are facing? So Najib, maybe we can start with you. Now, a lot of people don't know this about you. You actually started your company on, you're getting your second PhD at the UVA, the University of Virginia. You were working closely with the UVA Center for Telehealth and the legendary Dr. Karen Raybon. Now, since you've been expanding your platform, telehealth data analytic platform, TRP, across the country, what are some of the things that you've been seeing as some of the biggest challenges that teams have been facing when developing and implementing telehealth services?
Thank you, Sean. If I were to describe all the challenges in one word, I would say complexity or complexities. I hope by now many people know telehealth is more than just turning on video or having video capability across the enterprise. It's a lot more than that. COVID-19 was a curveball, as everybody knows, but even prior to the pandemic, there were challenges related to not everyone, especially in rural areas and medically underserved communities, not everyone has access to the technology. Not everyone have access to the broadband and the internet, and not everyone really understands how to use the technology, even if they had access to it. Now, with COVID-19, virtual access to care became a must, not just a nice to have for all the health systems, which created issues related to, hey, we need telehealth now. So a lot of smaller scale pilots and quickly stood up services popped up in different areas, different departments in the hospital, and they were very poorly integrated, not necessarily aligned with the overall system goals. So you add that to the fact that large-scale IT projects typically fail, at a rate of 30%, and there is a huge lack of sustainability when it comes to telehealth pilots. 75% of those actually fail. So just to recap, before COVID-19, everyone was trying to just justify why they need to have telehealth, get the physician buy-in, sort of clinical appropriateness, have the leadership buy-in, create creative, nice strategic plans to get them to fund those projects. Now with COVID-19, everything accelerated and the equation changed and everybody wanted to have it now. So the challenge is really, how do you scale the right services, and how do you make sure they're sustainable over time?
Yeah, and Najib, you mentioned one of the biggest myths that is still unfortunately around today is telehealth is not an IT project. This is clinical transformation. We need our IT counterparts to be able to collaborate with them and speak that common language to be able to do this together. But technology can't be parachuted into clinical delivery and expect success. So Dr. Ford, maybe let's go with you next. So the MUSC Center for Telehealth was founded in 2013, but a lot of people don't know this. The MUSC has been creating telehealth services as early as 2005. I know you were one of those early innovators at the forefront of that movement. What were some of the things from a physician perspective were you experiencing in some of those early days?
Yeah, thank you, Sean. I would say that from the physician perspective, certainly for myself and my peers that I've seen help initiate different telehealth services, our primary motivation are having tools and methodologies to improve the quality of care for our patients. And that's really what's going to drive effective physician engagement is being able to appreciate the fact that they can improve, the patient experience and patient clinical care. And I'll be honest, as a physician, we're not especially patient with regulatory and administrative considerations. That's really not our wheelhouse. And so I think by having a kind of preemptive checklist in Tsim, it will really guide an organization about how to address really foundational issues that institutions will need to consider before they really attempt to engage their physician leadership. And having some of those prerequisites already covered, before engaging the physician champions is really going to help the physician have the experience of being able to quickly start programmatic development that really is going to speak directly to that desire to improve patient care. And I think in Tsim, and we'll go over this, I realize, in a bit more detail, but, it starts with strategy. And so engaging that physician leader in the strategic discussion about the program is really going to help ensure that the service will meet patient needs and help really crystallize what is the problem that's being solved via the telehealth solution. So I think that early engagement in the strategic thinking about the service with the physician is really catching them early, and it'll help kind of keep them part of the journey. And then, subsequent to that, of course, the development pathway follows, and we'll go over some of that. And this has 4 different pathways within the development stage. And by having pathways such as technology or administrative and regulatory that don't have to necessarily include the physician champion in every detail, but does give transparency to everyone, that's part of this development process, will mean that the physician leader is appropriately informed on things they need to be informed about, and then engaged at some high level, at the very least, in all of the development activities. And really, the physician is critical in the development phase with regards to that clinical pathway development, which is really going to be the clinical workflow that the physician and all the clinicians are going to be using when they're providing that telehealth service. And I think it's important to understand that a telehealth interaction is fundamentally quite different from routine medical care, and really will require the clinicians, the physician included, to help think through how they're going to make that new workflow for the telehealth service, or how they're going to integrate a workflow into an existing care pathway. And having that physician engagement and that component, I think, is really what helps ensure that efficiency of care delivery is optimized, and then thus, the frustration and physician frustration and clinician frustration is minimized as you sort of move through the Tsim stages.
Yeah, I mean, when I first started out, I was involved in a lot of those meetings where you would have maybe a physician involved in an hour-long meeting, and we need them for a 5-minute decision. Or we're in meetings and you got all these stakeholders at the table, and you realize maybe the physician or some other key stakeholder is not there. So one of the key tools that we use within Tsim is a responsibility matrix. You can understand and be able to, it's very clear of who's responsible, accountable for certain steps, who's consulted and needs to be informed of certain steps. And we've made a lot of headway that way. So many of the things that both you and Najib described have either impacted or catalyzed the creation of Tsim. And so, at the Medical University of South Carolina, MUSC, it's nearly a decade ago, we were offered an extremely unique opportunity through support from our state legislature. And through that unique opportunity, we were able to do full clinical transformation, enterprise-wide clinical transformation with telehealth services. And what that means is, developing any service you can think of: tele-ICU, telestroke, school-based telehealth, remote patient monitoring, direct-to-consumer, and also in any type of setting you can think of. So by going through that phase of rapid development, we were literally forced to organize our processes, because everything was moving so fast, way fast, way more you'd have to organize if you were just developing like one telehealth service over a couple year period. And through that process, we organized through Tsim. We started to bring things together in a phased approach to be able to speak in a common language and be able to then, mature processes under each of those phases. And, that's helped MUSC really be able to expand telehealth services, across the state, and Tsim's really then be able to, serve as a roadmap, for not only MUSC, but now others across the country are starting to adapt the framework as well, and it's being applied with other teams, which is fantastic. So as we get into the framework itself, you've got telehealth ideas that come out of pipeline in a standard way, and then into the strategy phase. So the strategy phase is when the scope of the service is clearly defined, and there's a lot of things, within the strategy phase to be able to do that. Dr. Ford, maybe kind of start with you. Within Tsim, knowing that you have this strategy phase, what makes you just feel so confident of services coming out of that strategy phase?
Yeah, that's a great question, Sean. The imperative thing in the strategy phase is that at its conclusion, it is very clear to all stakeholders that that the problem that is being solved, what is that problem, first of all, and is telehealth in fact the correct solution? I mean, as you remember, we've seen plenty of ideas come forward that didn't
Not
actually
telehealth.
need a telehealth solution. So I think it really helps the stakeholders really think through carefully, what problem are we solving? Is telehealth the right solution? And do we have the right sort of launching pad and the right key ingredients, I guess I would say, to feel confident that we can apply a telehealth solution and actually address the problem in some meaningful manner. So to me, at the conclusion of strategy, you've really crystallized on that foundational kind of guiding principle, if you will, about the problem being solved, and telehealth is the right solution for it. And from a practical standpoint, it has a very structured and standardized form that we use that helps ensure that there's consistency across all these different services that the organization may be trying to launch over time, or maybe even concurrently, as you articulated from our own lived experience, so that people are speaking the same language, they're seeing the same standards applied for all different kinds of ideas that may come forward from within the organization. And I think that gives it transparency, and it gives people a common understanding of how we're going to sort of approach the notion of a potential new telehealth service. I also think a really important part of strategy is that's where you start thinking about what your success metrics are going to be, so that you're upfront already considering, we believe this is going to be a right solution to help improve the quality of care for patients. How are we going to measure whether we actually did accomplish that goal of improving some kind of an outcome related to patients and providers? So I think it really kind of gives you this guiding star sort of document that you can rely on and feel confident that you're all sort of rowing in the same direction. And I think conversely, it for sure helps mitigate the potential for mission creep. We've also seen where we are going to try to solve a problem with telehealth, and then it kind of becomes, well, let's solve these other things along the way. And that really, kind of can lead sort of things to fall apart a bit when you lose your direction. And so, by having that organizing idea and document that puts in a concrete way how that idea is going to start being operationalized, I think it just really keeps everybody aligned about what the priorities are and the goals are.
Yeah, and I think that's an important piece you mentioned there too about, because I remember we've had circumstances with this in the past with telehealth services where we were asked to say, hey, go in there, use telehealth as a solution to fix that. And I remember a specific example, which I won't point out by names or anything, where you identified, listen, there is foundational things wrong with this that we cannot bring telehealth in, right? Like the ground was not fertile to be successful. There's certain things that have to be improved before we can even come in and provide something. And I think that's important because as teams begin to expand across the country, they're probably going to be asked these things. Hey, there's this big challenge over here. Just telehealth it, fix it for that. And in some cases, you will be able to do that. There may be solutions that impact a lot of those challenges, but making sure that you have a good assessment of, is the ground fertile? Do you have some of the key elements from a potential readiness to be successful when you get in with that service? Emily, any thoughts from you?
Yeah, I guess the one thing that I would add in the strategy phase that I think is important is beginning to think about financial sustainability, right? Because certainly there's sort of the clinical strategy, but then there's also a sustainability component, and really knowing that the finances are important to maintain the service offering for the years to come, right? So there are a couple of ways that we think about that. One of the first decisions we make is to consider what the value-based strategy is. And by this, we mean, what is the value that we're offering the consumer, the customer, whether that's a hospital or a patient at their home? What is the value for the patients or the community of patients? And then from that, we're able to sort of solidify what the business model looks like. And there are many sort of examples of business models that to choose from. There's direct revenue model that we use for hospitals, for example, contracted services. We also have models that use indirect revenues, value-based payments, and so on. And then there's health equity business models that require sort of a diversity of funding sources. Regardless of what the business model is that the value-based strategy lands within, you have to consider it early on in the strategy phase and begin to plan for that for the long term.
No, it's such a good point, and I've seen a lot of organizations really struggle with this, and I understand why, because some telehealth models struggle in a historical fee-for-service system, and being honest and upfront and identifying what that sustainability plan is within the strategy phase, and specifically making sure everyone has the same expectations, because I've seen services expand, and maybe some folks on the team's like, hey, we're going to need this type of funding. This is not a moneymaker. And then other folks from the financial say, where's the savings we're getting out of this? So and it's already downstream. So to be able to identify that up front of, okay, what is this? Is this a revenue builder for us? Is this something that we're going to be able to expand our market share with something? Is this something that we're going to be able to get more downstream revenue? Is this something we're preparing as we take on more value-based payments is extremely important, and solidifying that up front. So extremely helpful. And like I said, the strategy phase is really the foundation of what sets everything else then downstream within the Tsim phase, the Tsim framework. So after you have all those things identified in strategy, you move into the development phase. I've always looked at the development phase as the build of the service. And so again, everything's encapsulated into this development phase. So when you think about the build of the service, you're thinking about creating clinical and operational workflows and protocols. You're navigating the complexities of legal regulatory issues like licensing, malpractice, creating partnership agreements. You're procuring, configuring, deploying technology, and finally, the metrics you identified in strategy, you are working to create dashboards and development. You're validating that dashboard. So that way, when you do go live in the next phase in implementation, that's already built. It's not like the service is live for a couple months and you're trying to figure out how to collect data on it. So Najib, you've been across the country and you've seen a lot of different organizations trying to create telehealth services. The development phase is something I think people often struggle with. I've seen people get stalled. What are some of the things that you've been seeing out there when people are trying to build these services?
Yes, Sean, as you mentioned earlier, the strategy is the foundation, and Dee also mentioned that it's very important, if not the most important part. Across the country, we see many groups really create a strategic plan or a business plan, sometimes even twice, 3 times a year. I think it's very important to clarify here that development is really where you put that strategy into action. And that's where we see a lot of problems happening, because in development while you're sort of deploying that service and getting all the moving parts together. That's where you have many teams from different backgrounds really try to collaborate together towards a common goal, which is seeing the first patient live and sustaining that service moving forward. And that really requires a lot of coordination, a lot of tasks that different teams and many members within those teams are responsible for. And that's where I think Tsim really brings a lot of value, because it helps coordinate better across different teams. It helps define responsibilities and roles across different teams. And it's important to sort of mention a couple things. There are two components, the way I see it in Tsim. The first one falls into two buckets. One is a collaboration. So you really need to create that service charter. That's the strategy. It's basically a detailed document of where everybody agrees this is why we're doing it, and that's what needs to happen. And then the next phase is sort of a project management piece. You have many teams. You really need a structured way to define how are you deploying, sort of developing the different aspects: legal, credentialing, scheduling, sort of the clinical workflows, the IT, the procurement, and so on, the billing and the financial aspects. But it's very important that everyone has a structured way, a structured lists of tasks that they're following every time they're adding a new site or a new provider to those services. That's actually what led us to create a software based on the Tsim framework. I think initially many of our customers tried to use off-the-shelf or already sort of available enterprise software for them, but it was very difficult because Tsim sits in the intersection between clinical, business, and technical. And it also brings the very sort of unique component of we need to collaborate around different documents. It starts with a service charter and scope. It also sort of follows through to the development phase where you have many different services. Each of those services are unique, maybe depends on the specialty, but they're also unique depending on what type of tasks you need to accomplish within those services.
Yeah, I would say there's been a lot of inspirations and things that catalyzed the creation of Tsim. I think probably our struggles through what is now known as the development phase was probably key to that, is because you have to navigate so many complexities, so many different stakeholders with expertise that all have their own individual capacity constraints. So how do you do that? And again, to your point, specifically with the Tsim software, telehealth is not an IT project going back, and so the typical project management resources for this is there's a start and a stop. This is clinical transformation. There is no stop period. There is you get into service management and then continuous quality improvement opportunities. So I think that's where some people still struggle. But people are starting to see that more and more, that we need tools to be able to effectively now manage this transformational change. So
yeah, Sean, just to be clear, I mean, you see many different teams really struggle even within the same organization. Some teams manage those tasks on Post-it notes on a wall. Some other teams manage it in Excel spreadsheets. And what happens is you have a huge risk of knowledge concentration, where one person knows what's supposed to happen. If that person moves on to another role or leaves on vacation, everybody is just looking at each other, what they're, and asking each other what they're supposed to do. And good luck finding those Post-it notes or understanding what's on them, or the Excel spreadsheets. So that's really a big value of Tsim, where you can bring everybody around a common goal with a clear understanding of all responsibilities, and most importantly, knowing what kind of resource and when to involve at the right time.
Yeah, I can't agree with you more. And so when we get into the implementation phase, which is next, you start getting into the training, the testing, and then through go live. Now, Emily, you've developed and managed, a lot of successful telehealth services going through this implementation phase. What are some of the things that Tsims provide value in regards to helping coordinate some of the teamwork communication?
Sure. Yeah. So implementation we sort of think of as go time. It's time to pull together everything that you've done in strategy and development and get the team ready to go live. And so one of the challenges is the variability, right, of what teams' expectations are for training and how go live will go and sort of the variability in service type. So the way we sort of combated that variability is by standardization. We really standardize the way that we run an implementation, and there are four key components there, I would say. The first is that we standardize the provider and clinical support team training, so that providers get the same training from provider to provider, and the clinical support team does as well, with service-specific competency checkoffs. I think the competency component is really important, right? We have some core competencies that every provider or clinical team member needs to be able to check off before they're prepared for go live. That's sort of a quality control for us. It's been really critical to our success, I would say. The second big component is mock calls. And so it's really a walkthrough of the entire process of the telehealth interaction, whatever that interaction is, including the technology. So it's testing the technology, but also the provider and team's ability to leverage the technology to have a successful telehealth interaction, right? So that's really the second important component, and it's really a simulation of an actual visit. And then the third big component is clinical or technical support for the clinicians at the elbow during go live. So we mock that up for the mock call, and then we also were prepared on the day of go live, or for that sort of critical go live phase, to have at the elbow support for the clinical staff and for the providers, so that if something does go wrong, we can solve it in real time and sort of save the visit and continue to move forward. And then finally, the fourth component I'd say that's really important is a post go live debrief. So after a certain number of interactions have occurred, and we feel like we have enough experience to really dig into what's working well and what's maybe not working well, so that we can solve problems, we actually sit down and go through a formal debrief. It's an open forum to sort of review adherence to that competency checkoff, including documentation and billing components, but also just sort of allows the group to talk about the lessons that we've learned and ways that we can improve the workflow, and gain insight from other team members that the group may not be aware of with the experience with the go live.
Yeah, and these elements, everything you're speaking of, really emphasize the standardization is how you create the reliability of all these telehealth services, making sure they navigate these things in development in a systematic, standardized way of how you're training the folks, how you're doing the mock calls, how you're having the post go live debrief to make sure you didn't miss anything. Dr. Ford, from your perspective, especially during the implementation, I know Emily mentioned kind of that at the elbow support. I used to always tell our teams, listen, our physician champions or leaders do not expect everything to go smooth. There's going to be issues, but what they do expect is that we will have the operational and technical support to rectify whatever happens as soon as possible. So any thoughts you have in regards to the implementation phase?
Oh, yeah, absolutely, Sean. It's understandable for a team that spent all this time and energy in the development phase, and they're finally seeing their first patient. And it's understandable that people might think they're done. It's like, we got it off the ground, it's rolling. We can all move on.
Not a finish line. Go live is not a finish line.
No, it's not. And just a few quick examples, some of our programs require our providers to be able to navigate multiple different electronic health records. And that's for sure not a seamless process always. And so making sure they can get the remote access, that they have the necessary login information from our partnering organizations that are often not part of of our health system. And so, after you've gone through all of that credentialing, you still have to make sure that your physicians are able to kind of get into that patient electronic health record that they're going to need to be able to understand what's happening with the patient. That's just one example. We've had situations where a program entirely designed around one acute problem, for example, maybe starts getting activated for other clinical reasons that really weren't what the program was designed to support. And so then you have to kind of pivot people to say, no, this isn't really a program that's going to meet, all your clinical needs with regards to this particular specialty. It's designed for this one really, potentially catastrophic issue. And so we really need to circle you back around to what the program was intended to support. Certainly documentation and billing are always things that need, careful oversight to make sure that the two line up well, that the documentation supports whatever the professional fee bill that's been dropped is. And, there are numerous other examples where that post go live debrief, where you kind of dissect out what's happening. Is it happening the way it's intended? Are we seeing workarounds start to evolve that we need to make sure we're doing a quick pivot so they don't become embedded? It really, the go live is just sort of the kickoff for the whole next phase of a telehealth service.
Yeah, I remember when we first started really formalizing Tsim, and we started then going back to services that were created pre-Tsim and saying, all right, let's do a good systematic review, a post-go live debrief, even if they've been live for a year or 2 years, and we found deficiencies in either the process or maybe providers' documentation that was impacting revenue capture and billing. So all those things help make sure that you do not miss a step, in the process. So once not only go live, and then they pass the go live debrief, because services aren't advanced into the next phase operations until they're fully built and doing exactly as they were intended to do. Then it gets into an operations phase, not only of a maintenance, but maintenance and optimization. So Emily, you've led some of the most successful telehealth services there is. From an operations standpoint, what are some of those things that you focus on, using the Tsim framework that's really, helped your teams and help make you confident in the services that are being delivered to our patients?
Mm-hmm. Yeah, so, operations can be a beast, right? Because there's so much to consider every day to keep the service successful, effective, efficient. So we try to break it down into sort of chunks or domains that we can focus on specifics within. So the three big domains that we think about in operations are customer success, technology management, and operational effectiveness. And the way we sort of think about within the Tsim framework, customer success is sort of the management of day-to-day operations to deliver high quality telehealth services that continue to improve both the patient and provider experience, because obviously the patient and the provider are our customers as a Center for Telehealth offering these services. So there's sort of a customer engagement component when we think about external customers like hospitals, and that piece is really important to maintain the engagement of our customers with open communication and sort of ongoing problem solving with the stakeholders that are our customers out in the field. And we also offer quality reporting and sort of a benchmarking component. So again, to use the example of hospitals, we have hospital services in 20 or 30 hospitals. We offer them some comparators, right? Benchmarking data to sort of see how they're performing within the consortium of hospitals, and then target things that they might be able to improve that we can certainly help them with. And then there's a training management component. Again, to sort of stay with the theme of the hospital as our customer, hospital teams turn over, right? So we can go live with a service and have the team trained to deliver really well, but in a year's time or 2 years' time, we have to continue to maintain that sort of training and competency. And so there's a big component of training management that's integral to customer success.
And I was gonna say these are the things that really impact quality, which I've seen, you deliver, Dr. Ford deliver. And I've been talking to other people about this. When you've got services like telestroke, tele-ICU become a common thread through a bunch of organizations that are maybe not under one umbrella, complete different organizations, different health systems, different teams, and to serve as a common thread and to have that type of process and framework to be able to standardize and then focused on, improving door to needle times, improving compliance with best practice in the ICU. When you have that service laid out, it really exposes some existing vulnerabilities in those systems that they may not even realize they had until they're able to compare against, their peers. And then using some of those best practice to elevate them to be able to match up. It's really been pretty impressive to see, some of the work you and Dr. Ford have done.
Yeah, thanks. It's an important point. Another point that I'll add that I think has been key is sort of tracking engagements with those customers, right? And one of the ways we do that is in the Tsim software. We have a way for our clinical outreach coordinators to really track those interactions, the data that they shared, the process improvement projects that they're working on, and so on, so that we sort of stay on top of that relationship with the customer, with the site, with the key stakeholders at the site, and sort of know where we are in our relationship, because every relationship isn't the same, certainly, and some require a little more nurturing than others, and so having a place to sort of store all that information and keep track is really important.
Yeah, I know that was helpful for us of making sure that we weren't always having the attention to the squeaky wheel, but there was at least some baseline level of engagement with all. I mean, of course, you got to put out fires sometimes, but having a baseline level of engagement with all, customers, different health systems, or whatever it may be, is extremely imperative to make sure you're doing that. I think I heard you use the term once, kind of upfront gardening, to make sure that things are still working well and being proactive when doing that. The kind of final phase in Tsim is continuous quality improvement, CQI, that really transects the whole entire framework of Tsim. You could apply it to improve processes and things throughout, but there's a lot of work when it comes into operations. So it kind of just falls in, services go live. They were built with a specific, intention, but things change. Whether it's, people or the technology being applied. Can you maybe speak to a little bit more about that, Emily, of how you guys are applying CQI to help improve optimized services?
Certainly. So before we move into CQI, we have to sort of know how the service is performing and the site is performing. So we have one of the domains and operations that we focus on is operational effectiveness. And we measure that with a few different categories of metrics. So first is sort of utilization. We look at how often the service is used, but that's a pretty basic and preliminary way to evaluate a service, right? There's much more that we've learned over time that we need to look into. And so certainly sort of the patient and provider experience we look at, and we use Net Promoter Score. I'm not sure that the tool matters as much as that you're looking at on a regular basis for every service, what the patient experience looks like, what the provider experience looks like, and how we can improve. We also look at efficiency of care delivery, and for every service, that's a little bit different, right? For stroke, it's time to expert consultation, and we're looking for less than 5 minutes. For other services, it might be within 24 hours getting a consultation because it's not as urgent. So every service has its own efficiency of care delivery metric that we look at. We look at technology reliability, which is really important, and then more recently have started looking at sustainability, because obviously sort of financial sustainability is important to continue to offer the service. So once we have that sort of baseline data for every one of our services that we're tracking across the whole Center for Telehealth and alongside our customers, then we can look at where we're underperforming, or we think we see opportunities for improvement, and begin to pursue the continuous quality improvement process. And so that process can really occur anywhere in the Tsim framework, but I would say most often occurs in operations, because the services are live and have had time to sort of work through some of the challenges and maybe fail in certain places. And as I said, we're tracking the data to be able to go in sort of eyes wide open to what the problems are and how we want to improve. And so, so generally what we do with continuous quality improvement is the requests for improvement can come from our customers at a site, or they can come from the Center for Telehealth team observes that something isn't working very well. And then we as a leadership team really assess what the request is for an improvement initiative and decide what sort of resources we're going to put to it. Meaning like some quality improvement initiatives can really stay in operations and be iteratively improved, but others will really require the full sort of work of the Tsim framework and development, and maybe even rethinking strategy if it's a big change, but certainly going through those sort of swim lanes within development and making sure that if there's a software change that needs to be made, we're really walking through every step of the process again. So the level of continuous quality improvement treatment that an initiative gets is really sort of decided at a leadership level, and then we'll allocate resources appropriately.
Yeah, I think that's one of the nice things about Tsim, where you could have something that, like you mentioned, is in operations. You can have an agile, very small changes to improve things, optimization, but then some things, major shifts happen, and you do maybe have to take it back to strategy or just through development to make sure, hey, we've got maybe a new technology. So now we have to procure, we have to train on the technology. We have to make sure it's maybe integrated with EHR if that's applicable, all those different things. And you can do it through a standardized process through something more light. Dee, want to ask you about this, because again, the myth of, telehealth and IT project, what it's not, this is clinical delivery. This is clinical delivery to patients. So from a physician's standpoint, how important and valuable is something like the CQI phase in your mind?
Thanks, Sean. No, I mean, I think the CQI phase is really instrumental to obtaining and growing and solidifying physician engagement. And I'm really glad Emily spoke just a moment ago about the pivotal importance that data and outcomes reporting has when it comes to a telehealth service. Before the pandemic, if you were to approach a physician that maybe didn't have any experience or even interest in telehealth, you'd hear folks kind of say, well, I don't know, show me the data, that telehealth is any better than what we've been doing the last century and how we deliver care. And so by building that data component into the telehealth service right up front, you're automatically building that foundation to show a quantitative improvement in some manner and sort of how that patient is receiving care. And as Emily just highlighted, if you're identifying either process outcomes that could be improved upon, like time to expert stroke consultation, or in critical care medicine, adherence to ventilator best practices, which is an important process measure. We know that these things ultimately drive hard patient outcomes like mortality. So when you can bring that data in a longitudinal manner to help inform programmatic improvements or show program success, it absolutely is essential for the physician engagement side of it, and to really present to all of the stakeholders, including leadership, to show value in a meaningful way for the telehealth service. So the CQI component is just really instrumental to enduring success for a telehealth service.
Yeah, thank you. And I know we're getting towards the end, and I want to get to some of the questions in the Q&A section. So I'm going to try to give one to each of you. Emily, I think I'm going to start this one with you. From an administrative leader that's been doing some telehealth, but they've got a kind of a charge to expand in their organization. What would you say to them? So say maybe it's a new administrative leader or someone who has this charge to expand telehealth services across the organization. What would you say to them, of really the value of Tsim to them?
Well, I think Tsim helps us get organized, right? It can be overwhelming to begin building telehealth services. And so I think just because there's so many different factors to consider and track and keep everybody on the same page about. So there's great value we found in having a documented plan and really a recipe for everyone to walk through transparently. Everybody knows sort of where we are in the process and what's coming next. And we really get good at anticipating the challenges before they sort of pop up for you, and going ahead and addressing them in a timely manner. So that's sort of what Tsim has brought us. It's a organized way to approach the development of a service without forgetting anything, in an efficient sort of way.
Yeah, no, absolutely. Najib, I'm gonna give this next one to you. So a question on about can any organization of any size use TSIM? I know you've been working with organizations across the country. What would you say to someone like this? What would be your response?
Well, the short answer is we really work with different teams, teams of 3 to 4 people, or teams of 30 to 40 plus. But I think it's also important to make a distinction. The size and sophistication of the telehealth operation does not really correlate with the size of the health system. In other words, you might have smaller health systems that are doing a lot more and are more sophisticated, have bigger teams around telehealth than some of the larger health systems. It's also important to know that even if you're a team of 2 or 3 and you're just starting out, it's true that it can be overwhelming, but not necessarily everything should be applied from day one. It's basically building the operation brick by brick, and the value of TSIM is really not to adopt the same exact scoring card that was developed by MUSC, but the fact that you have that checkpoint, you have a scoring card, you have a service charter. So that's really sort of the value. It brings the discipline, it brings the structure to even, and I would argue it's easier to have a team of 3 people all on the same page with all the change management than a team of 30 plus people to do that. So that I think I always argue the earlier start, the better. With that, then we also mentioned the software in a couple of spots here throughout this discussion. One of the things we're doing and we're very excited about is because we're working with different size organizations, and you would think that they're all different because they have different services, they're in different locations, but there is always a common core of how people are thinking about developing a service or what kind of service they're going to be developing next. So what happens, what we've noticed is, I have some friends who call me up and say, hey, I know Sean or Emily built school-based telehealth. Can I talk to them and learn from them what they did? So we're very excited about TSIM because it brings that structure, and we're also going to be benchmarking that knowledge. And I'm saying knowledge sort of, by intentionally saying just knowledge, not that's the specifics, so we can benchmark them and start creating real standards around, how do you take new service requests, how do you prioritize them, how do you scope them, and how do you successfully deploy those services and make sure the quality are above par, and you're really competitive in a market that's becoming more and more competitive. And so that's basically my answer to that. And the problem of having of telehealth groups being under-resourced has been really emphasized by COVID-19, because you had groups of sometimes 3 to 4. Telehealth blew up in so many different departments. Now, after COVID-19, people are just different stakeholders, especially the leadership, are looking back and say, hey, team of 3 or 4, now go manage all of this. And that's where I think TSIM could be extremely beneficial to be organized and make sure you're successful in that charge.
Yeah, no, I agree with you from if you have the opportunity to start small. I mean, a majority of telehealth departments are started as a department of 1. And to be able to organize that first, and as you expand, get everybody on the same page, speaking that same language, is extremely helpful. So we'll take one last question. I'll give this to you, Dr. Ford. It looks like it's a physician leader who's got the charge to be leading some telehealth, digital health application type of leadership within their organization. What would you say to them of why they should learn more about TSIM and how it would help them from a physician leader perspective?
Yeah, that's a great question, Sean. Because the physician leader who maybe gets charged with trying to quote, do some telehealth is going to have absolutely no idea where to start. I mean, they know how to take care of patients, they have leadership skills, but that really doesn't inform them as to all of the different steps and things that need to occur to be able to sort of launch that telehealth program. And, TSIM gives that individual physician leader, as well as their team, whether that team is 3 people or 1 person or 30 people, it gives them a clear guidebook. And it gives the organization a clear guidebook to be able to go through the different steps that need to happen in a very efficient and organized way. And I think when a physician leader experiences that, they become engaged in that development process. And really, I think we've all seen this ripple effect where if that respected physician champion becomes a believer in telehealth, then their peers are going to become believers. And it has that sort of ability to engage more physicians either at the level of providing care or even at the level of wanting to start developing their own services for their own patient populations that they're seeking to really drive that improved outcomes, like we already spoke about at the very beginning of this webinar. And so I think, the physician leader that brings Tsim to their organization is really going to help launch a lot of these transformative changes in how we're delivering care and how we're improving patient outcomes.
Yeah, thank you, Dee. Appreciate that, and thank you to Najib and Emily, the whole panel here. And thanks for everyone for watching. We really appreciate it. I hope you found this webinar helpful. I hope it makes you encouraged to want to learn more about Tsim. And if that's the case, I encourage you to visit our website, tsim.telehealth.com. There you'll be able to learn also more about the upcoming Tsim guidebook that's going to be published later this year, and also the Tsim software that Najib referenced earlier. So I appreciate you guys for tuning in, and I wish you all the best in your telehealth journeys. Thank you.